Documentation is ripe for a big change. And I don't know how we got to where we are today. Some people think that maybe it's because we started hiring English majors that like to write to work in the laboratory, and the procedures got longer and longer and longer. I'm not sure what generated it. All I know is our procedures are really long. It's very difficult, one, to read them for review, but more importantly, to actually use them on the bench. So I think that what is likely to happen is we will simplify, and whether we'll do it globally or we'll do it incrementally, I'm not sure. We are now seeing some incremental changes where we've used what's called job aids, and for us there are two types of job aids. One is something physical that helps you do your job in the right way, and the other is a set of work instructions that is an abstraction of the procedure into very simplified, straightforward steps that can be printed out, put on the bench, looked at to make sure you follow each of those steps, and it has the critical warnings built into it. So a one-pager, if you will. We're starting to see in our laboratory technologists adding those to procedures. Sometimes they're adding them with pictures of critical steps. So for example, if a label needs to be put on a tube in a very specific location so that it can be read within an instrument, we might have a picture of that rather than a lengthy description. So I think we're moving that direction, and by having a simplified set of instruction, you then free up your mind to actually do that analysis at hand and follow those instructions. The rest of the procedure can be used as a training document and a historical document to include in it all the cautions, the thou shalt nots, the once upon a time we had this happen in this assay, so make sure you don't ever do it when the moon is full. Those sorts of things don't need to be handy at the bench. You may still want them in the procedure, but I think the procedures are going to change their format. The job aids will move to the top, the rest of the procedure will move to the background or to the appendix of the procedure. It'll make review a lot easier. The other aspect of having a procedure that's easy and highly visible with clear-cut steps, clear-cut branch points, is you can use that procedure for an uninitiated person to do an observation of a technologist doing the test. That means you don't have to know the steps of the procedure. You can have them in your hand and watch the technologist to see if they follow those steps. I think it's very difficult, if not impossible, to do when the procedure is 26 pages long. You spend all your time reading and no time observing. So simplified, clear procedures, I think, are the wave of the future. I think they can help prevent errors, and they can allow you to do some of your other tests, like competency observations, in a more straightforward and efficient fashion.